Well, around 1 in 2 adults in the U.S. have been affected by some kind of condition that causes pain in their muscles or bones. And next Tuesday, Sharp Healthcare is hosting an expo where people can see some of the common ailments and treatment options for those issues. And here to talk more about bone and joint pain, we have Dr. Amar Arora, orthopedic surgeon with Sharp Healthcare. Thank you for being with us this afternoon. Okay, what is the main reason so many of us, I say us, me included, are dealing with joint pain, some aches and pains?
Yeah, I think that's a complex question, and I don't think there's a simple answer. I think the issue is that we don't have to expect pain to be overcoming. I think there's a lot of answers and solutions for pain. So even though it's expected to have a little bit here and there are some solutions if we start to get that pain that's interfering with what we want to do in life.
Yeah, and you say interfering, that's a good word, because I don't know. I'm just like, am I just getting older? Right. Like, why does it hurt to sneeze?
Oh, I know. I mean, there's so many different reasons, right? We can talk about arthritis pain.
Yeah.
I think a lot of us know that our joints get a little achy as we get a little bit older. That's one part of it. There's muscular pain, whether it be because you're just not active and so the muscle mass isn't quite there. There's nerve-related pain just because the nerves get a little more sensitive. There's a whole host of different things. So we can tailor treatments based upon, what the identifying factor is.
Sure. And you're an orthopedic surgeon.
Yes.
What types of injuries do you see most common with your patients?
Oh yeah, my focus is on knees and shoulders. So we see a ton of patients who come in with a variety of pain-related issues with those two body parts. Of course, we see the back pain, we see the lower extremity pain in the foot and ankle as well. But again, there's so many different options out there, and I think this Bone and Joint Expo is here for the patients to learn more about all those types of pain.
And you know what? Talk to me a little bit about what we can expect next week with this expo.
Yeah, it's going to be great. I think there's going to be 3 or 4 different physicians who will be talking about different type of subfields, shoulder, hip, and knee. There'll be a couple of vendors, and of course the medical community of Sharp will be there to go over anything that may be a question to be answered about specific issues, general ideas, and maybe on the cusp thinking about technology could be helpful too.
Sure. And I think it's really great that Sharp offers these types of expos, because sometimes people will end up just living with the pain because they don't want to go and ask questions, or they think it's weird to ask questions. But at least you guys have this expo. It's open to anyone?
It's free.
It's free? Okay.
Yeah.
Okay.
And you're there, and you really want to come there with an open mind. Open the door to something, and then maybe then explore further options with your physician or your medical provider, whoever they may be after that.
Well, let me ask you this. Say you're dealing with some type of pain. When is it severe enough that you have to go see your doctor? Right.
I mean, I think we all live with some bits and pieces of pain. I think when it gets to a point where it's interfering with your daily living, for example, let's say it's interfering with nighttime sleeping habits, or your daily living of putting dishes away or eating properly or something of that nature, certainly it's a good time to talk about why that's interfering with those, things that we take for granted. And then of course, if you're an athlete or you're a recreational athlete and that activity-related pain is interfering with you being out there, and that could be because of your bone and joint health, it could be cardiovascular health, or it could be just the mental relief that you get from being active. If that starts getting affected, then of course we want to hear about that to see how we can help.
And what about surgery?
Well, we always think about surgery as things that are on the cusp of things that can be helpful, but we never want to use that as the first line treatment.
Sure.
So we have plenty of options that are there for us to use non-operative up until a point a surgery can be considered. But I think it's not something to be afraid of. I mean, I think we put it out there as a surgical option. At least people are aware that there are some options that can be there if the non-operative treatment doesn't work.
Right. Okay, so let's make sure that the folks know. Let's bring up that full screen again with all the information about the expo that's happening next week. This is the Sharp Bone and Joint Health Expo. It's happening on Tuesday, September 1st at the Sharp Prebys Innovation and Education Center. That's from 5:30 to 7:30 p.m. So after work, it is free to the public. And if you'd like more information, you can go to fox5sandiego.com, click the Scene On tab, and we'll make sure we have that link up for you. Doctor, thank you so much for coming back and visiting us.
Of course, anytime.
All right.